thousands of Medicare plans were just dealt a massive blow by CMS, Centers for Medicare and Medicaid Services, and at the end of the day, this is ultimately going to flow back and impact a huge percentage of the roughly 70 million people enrolled in Medicare. Now, I want to bring it to your attention because when we look at this from face value, we might think, who cares? This doesn't really matter. It's not going to impact me. Yeah, it's actually going to impact probably half, at least, or more of the Medicare beneficiaries that are out there, and I want you to be very aware of this, okay? Now, I also do have this article right here, which I'm going to pop up on the screen in just a minute, so you can see and read for yourself exactly what's going on here. I'm going to be fair. It's kind of confusing to read through this. I want to pull out some of the key details within the article here and what we need to focus on, because this is actually pretty big news. And again, this really changes everything in a huge way around Medicare. Now, I've been saying this throughout the last several weeks since we started 2026, and I said this a bunch at the end of 2025. I said, get ready. Medicare is going to be changing in ways that we've never seen before in 2026. And that's what we're seeing. In fact, I've seen a number of comments down below from those of you in the community who have been reaching out saying, can't see my doctor anymore. Why are my prescriptions significantly more? All of these different changes within your Medicare plans. If you think that's a lot of changes, get ready. We're going to see some other massive, massive disruptions within a lot of Medicare plans. Now, as I talk, I'm going to pop up on the screen here a bunch of new comments that I just pulled out of the comment section yesterday from those of you in this community that have called Chapter there with the phone number to get free help with your Medicare. Again, finding the right Medicare plan and coverages for you and your personal needs, which let me say this really fast. If you're on Medicare, you certainly want to make that call, because here's the deal. What I'm going to share with you here in this video, a lot of things are changing in a massive way. Take advantage of a free service. There's not that many things that are free anymore these days. Free, you can see it right there, free Medicare help. Again, give them a call after you talk to them. Drop your comment down below. Use the word chapter within your comment. I'll grab your comment. I'll add it to my stack of ongoing papers, page after page of all the comments. Amazing. Over $2 million of collective savings from those of you in this community just in the last year. Over 10,000 of you in this community just in the last year have called the phone number there. Absolutely amazing. Now, here's the deal. If you're on Medicare, you're going to need that help at some point anyway. Let me help you with this. Again, it's totally free. And my secret little goal by the end of this year is to help those of you in this community collectively save $10 million by literally getting free help right there. Absolutely amazing. We're already at $2+ million. Let's see if we can get another $8+ million of collective savings for those of you in this community. All right, anyway, I look forward to reading your comments, by the way, and let's talk through this. Okay, so here's the deal. Remember last year, end of 2025, as we rolled into 2026, what happened? We saw tons of Medicare plans being dropped, right? Eliminated, gone, right? You saw this all over the place. All kinds of plans just being completely eliminated. In fact, I don't know, maybe a week or 2 weeks ago, I had a video out just talking about United Healthcare and Humana. Just these two alone have eliminated over 400 counties across the country as far as coverages. That's just two of the largest insurance providers. Over 400 counties eliminated, impacting millions of beneficiaries. Again, that's only including those two. There's a bunch of other insurance providers out there. Now, here's the deal. Last week, we got an announcement out of CMS. Again, CMS stands for Centers for Medicare and Medicaid Services. They oversee Medicare and Medicaid. That's right there in the name of it, right? Anyway, last week they came out and they announced basically compensation going forward for these healthcare insurance providers of just an increase of 0.09%. Basically flat. Now, analysts were suggesting and predicting that CMS was going to come out and increase their compensations by between 4 and 6%. Okay, they came back and increased their compensations by less than 1%, like significantly less than 1%. That's a big deal. What does that mean? That means going forward, guess what these health insurance providers are going to be doing going forward? Are they going to add more plans? No. Are they going to keep the same amount of plans? No. Are they going to eliminate plans? Yeah, in a huge, huge, huge way. Why? Because they're no longer profitable for the same reason that we saw all the plans eliminated this year. In fact, let's pop this article up right here, right now. Feel free to read through the details on this. I'm going to be fair, kind of confusing, but there's a couple key points within there that I'm explaining now, and you can kind of see that within this article. But it's because of the compensation that CMS is going to be allowing for these different healthcare insurance providers. Because of that, these insurance providers are not allowed to keep, or I shouldn't say allowed, they're not going to be able to keep as many plans as they have available. So they're going to start eliminating plans in a huge way, which is ultimately going to impact the beneficiaries, because when they limit access to these plans, that means less availability of plans in your local area, in your local region, whatever it happens to be. Therefore, beneficiaries may be forced into just like a couple plans that are available in their local area. That's the situation. Now, is all of this going to be happening right here, right now? To be fair, no, it's not how it works, right? There's a lot of times that when we see these different changes that come out, beneficiaries think like, oh no, my Medicare is going away tomorrow. No, that's not how Medicare works. It goes on a calendar basis, right? So each calendar year, they may eliminate a bunch of plans. So we're probably good for now. I would still suggest for sure calling Chapter. When you see the phone number there on the screen, call them for sure. I think you're going to be shocked with your flexibility and your optionality right here, right now. For a lot of people, like millions and millions of people, still have a lot of flexibility and optionality right now. I think you're going to be shocked with what options you may have. Call them again. And again, you saw a bunch of pages of comments. I have multiple pages of comments here, like, I don't know, a dozen pages or more of comments that I've just pulled out in the last, call it 2 months or so, out of the comment section. From those of you that have reached out, collectively saving $1,100 on average. Again, when you call Chapter there, absolutely amazing. Again, no guarantees, but they're going to help you find the right Medicare plan and coverage for your personal needs in your local area. But point being is that there's going to be a ton of these plans that are going to be completely gone, eliminated going forward, because these health insurance providers are not going to be able to allow all of these different plans to be available because they're not going to be getting compensated from CMS. Therefore, when the compensation is not there, well, they need to get rid of the plans because they are not making money on them anymore, right? They're not profitable. And here's the deal. We might look at this and think, oh, what a crock. What a crock. I mean, seriously, right? They're not going to allow a plan because they're not making money. That's how it is. These companies are for profit. They are not charities. They are not nonprofits. They are very clear about how they are working for profits, right? They are very much a for-profit corporation. Therefore, if they can't make money doing something, they're not going to do it, right? And that's kind of the nasty part, is that who gets hurt at the end of the day? Who is the one that is impacted at the end of the day? Is it just, is it them? No. They're not going to put themselves into a position where they're not being compensated properly and they're not going to make money. It's the beneficiary, because what happens is then all of these plans get eliminated, they get discontinued, they get pulled, and therefore the beneficiaries that might have been on one of those plans at one point no longer have access to that plan. Does that make sense? And therefore, as they continue to eliminate more and more of these plans, that reduces optionality for people that are on Medicare plans or to have access to these plans through their Medicare. Does that make sense? Right? So at the end of the day, who does it impact the most? The beneficiary. Okay? Anyway, I want you to be very aware of this, okay? So just one simple little act out of CMS, Centers for Medicare and Medicaid Services, on compensations to these health insurance providers ultimately comes back to the beneficiary in a pretty big way, right? And this through the elimination of plans and coverages, or maybe the plan is still available, but what are they going to do? They're probably going to raise the premium, probably going to raise the deductible massively. They're probably going to raise the max out of pocket. They're probably going to reduce coverages for different procedures and different things. They're going to add all these different parameters so they're not on the hook for as much expenditures because they don't want to pay that expense out of pocket, right? So that's the deal, is they're going to put more of the burden onto the beneficiary, if that makes sense, okay? Anyway, I want you to be very aware of this stuff. A lot of major changes coming forward here. Let me know what else I can do for you. Again, if you're on Medicare, anything like that, if you need to enroll in Medicare, if you're turning 65 in the next 3 or so months or even 6 months, please call Chapter there. See what they can do for you. I think you'll be shocked. You'll be very surprised. A lot of you out there have optionality, have flexibilities right now, and you may not even realize it. I've seen so many comments down below so far this year from people that have reached out and said, can't see my doctor anymore, can't go to my office, can't go to my clinic, my prescriptions aren't covered anymore. Why did I get this huge bill? yeah, your plan probably eliminated all kinds of things and you didn't even know it. Well, if you don't like your plan, which a lot of us don't like our plans, call Chapter, see what they can do for you. I think you still may be shocked with your flexibilities and optionality that you still may have right here. Anyway, after you talk to them, drop a comment down below on any video here on the channel. It does not matter the video. Just make sure to use the keyword chapter. That's the keyword I search for. I'll grab your comment and I'll add it to my list of comments here, again, that I'll continue to feature in upcoming videos. Absolutely amazing. I love reading those comments. It's really, really cool. All right, anyway, please enjoy your day. If you have not done so, subscribe, 100% free, big subscribe button down below. Please share the video, big share button down below. Otherwise, have a good one, take care, and I look forward to seeing you again soon later in the next video. And also, I look forward to reading those comments after, again, you call Chapter there. Amazing, free. Everything here on the channel is free. Love free stuff. All right, anyway, enjoy.